My central goal for this video is to explain the impacts of the Mediterranean diet on obesity and metabolism, as well as other health conditions such as cancer. The Mediterranean diet is based on foods that are easily available in countries that border the Mediterranean Sea. This diet is rich in vitamins and minerals, as well as antioxidant and anti-inflammatory properties that benefit the body. There are 9 essential components to the Mediterranean diet. The first is the high consumption of monounsaturated fats, rather than saturated or trans fats, which can be done by eating more olive oil, canola oil, sunflower oil, and avocados. Eat less butter, meat, coconut oil, and dairy products. The second component is the high consumption of legumes, nuts, and seeds. This can be done by incorporating more beans, peas, lentils, pecans, almonds, and walnuts into your diet. It is important to acknowledge that nuts are low in unsaturated fats but high in calories, so it is recommended to eat about a handful each day. The third component of the Mediterranean diet is the high consumption of non-refined grain products, which can be done by consuming more brown rice, popcorn, oatmeal, whole wheat bread, whole wheat pasta, and rice cakes. Eat less refined grains, which consist of white bread, white rice, and sugary cereals. The fourth component is a high consumption of fruits, and the fifth is a high consumption of vegetables. The sixth component is a moderate consumption of dairy products, which can be done mostly in the form of cheese or yogurt. The seventh component is a low consumption of meat and poultry, and the eighth is a moderate to high consumption of fish and seafood. The final component of the Mediterranean diet is a regular and moderate consumption of red wine if already consuming alcohol. Men should have no more than 2 5-ounce glasses of red wine a day, and women should have no more than 1 5-ounce glass a day. This component is not for everyone. If alcohol is not typically consumed, do not start drinking just to follow the diet. It is important to remember that physical activity and a non-sedentary lifestyle are essential to the diet. The Mediterranean diet has many benefits that can combat obesity. According to the World Health Organization, obesity is defined as abnormal or excessive fat accumulation that presents a risk to health. The Mediterranean diet has been identified as the most effective method of prevention against obesity and obesity-related diseases. The vitamins and minerals in the diet, along with physical activity and a non-sedentary lifestyle, can contribute to weight loss. The Mediterranean diet contains plenty of dietary fiber, which can be obtained from beans, legumes, avocados, vegetables, fresh and dried fruits, whole grains, and nuts. Foods that are rich in dietary fiber may affect satiety, which is the sense of feeling full after eating. When food is ingested, receptors in the hypothalamus and paraventricular nucleus of the brain are suppressed through histamine neuron activation, which lowers the eating speed and volume. Satiety may be promoted through the prolonged chewing of these foods. By feeling full sooner, less food will be eaten, and it can therefore lead to weight loss. Also, cholecystokinin, a gastrointestinal peptide that promotes satiety and regulates gastric emptying, is secreted in the small intestine once food is ingested and its nutrients are detected. It has been shown that fiber especially has promoted the release of cholecystokinin. The Mediterranean diet is high in monounsaturated fats, commonly referred to as healthy fats. They can be found in foods such as olive oil, canola oil, avocados, and most nuts. Consuming monounsaturated fats rather than saturated and trans can promote weight loss. This increases high-density lipoprotein, or HDL, levels in the body, while reducing the level of low-density lipoproteins, also known as LDL. HDL is referred to as the good cholesterol because it picks up excess cholesterol in the blood and moves it to the liver to get broken down and removed from the body. LDL, on the other hand, is referred to as the bad cholesterol because it can build up in narrow passages in blood vessels, eventually leading to heart attacks and stroke. By lowering the LDL cholesterol levels in the body, it can help to decrease the amount of fat tissue. The Mediterranean diet also positively affects the speed and efficiency of metabolism due to many helpful nutrients and minerals found in the food. An example would be protein-rich foods. Some of these foods include legumes, nuts, seeds, beans, fish, lean meat, and poultry. Dark leafy greens such as spinach and kale may also boost metabolism due to their magnesium and iron content. Selenium plays an important role in metabolism as well. Selenium can be found in some nuts, lentils, beans, oats, sunflower seeds, brown rice, as well as whole wheat and whole grain products. Vitamin C is another vital nutrient that can boost metabolism and energy levels. It can be found in many fruits such as oranges, grapefruits, strawberries, cantaloupe, and tomatoes. Also, vitamin C is found in vegetables such as raw red and green sweet peppers, broccoli, cauliflower, Brussels sprouts, spinach, peas, and potatoes. A faster metabolism may assist with weight loss and therefore prevent obesity-related diseases such as hypertension, type 2 diabetes, coronary heart disease, stroke, and cancer. The Mediterranean diet has benefits that assist with fighting off various health conditions. First, following the Mediterranean diet during pregnancy has been linked to a lower risk of neural tube defects, premature births, and growth restriction of the fetus. It also lowers the fetus's susceptibility to gain weight later on in its life. The diet has also been associated with a lower risk of coronary heart diseases and cardiovascular mortality, as well as metabolic syndrome in adults. Also, current research is suggesting that the Mediterranean diet may be helpful in the prevention of Alzheimer's and Parkinson's disease. The Mediterranean diet has also been proven to reduce the risk of cancer or the redevelopment of cancer in pre-existing patients. The high contents of antioxidants and anti-inflammatory nutrients found in the components of the diet, such as legumes, fresh fruit and vegetables, nuts, olive oil, and fish, protect against cell degeneration and the increase of cancer cells. They also reduce tumor growth. Omega-3 fatty acids are vital for the body. They help to slow down the development of cancer, and they decrease the chances of survival for the cancer cells in the body. They also lower inflammation in the body, and they lower the risk of metastasis. Metastasis is the development of secondary malignant growths at a distance from a primary site of cancer. Omega-3 fatty acids can be found in different types of fish and seafood as well as nuts. Thank you for watching. I hope this video inspires you to try the Mediterranean diet. You may find yourself enjoying this healthy lifestyle as well as the many benefits from it.